Doctor, why do I wake up so often at night to urinate? This is a very common question for both men and women. In this video, I'll discuss the causes, reasons, and potential solutions. Today, we'll address a condition that affects both men and women. It's called nocturia. This is the habit of waking up twice or more to urinate at night. Waking up once is considered normal. We don't count pre-sleep or first morning urination. Frequent night urination greatly disrupts sleep quality and life. It affects the next day and interferes with daily functions. This is crucial for the elderly as nighttime waking poses risks. Risks of accidents and falls that can often be traumatic. Before we dive into causes and related conditions, we need to distinguish two things: the patient who wakes up to urinate versus the one who wakes up and then uses the bathroom. The patient who wakes up to urinate likely has a urological cause. But the patient who wakes up often at night to use the bathroom may have a sleep disorder. So it's crucial to refer urological issues to a urologist. Main causes include reduced bladder capacity and increased nighttime urine production. Often these two causes are combined. We know that after 65, 1/3 of urine is produced at night. When this value gets too high, we might use a voiding diary asking patients to record amounts. If it becomes much higher, it could indicate a pathological condition. Now let's look at the main conditions related to getting up at night to urinate. The first cause is heart failure, venous insufficiency, or lymphatic insufficiency. But why so much talk about insufficiency? These conditions include heart failure, cardiac issues, and venous problems like varicose veins. All these conditions result in lower limb edema, causing leg swelling. So patients who move a lot during the day with these issues retain fluid in their legs. When lying down to sleep, this fluid tends to flow back into the vessels due to gravity. It returns to the blood vessels, and this fluid goes back to the heart. From the heart, the fluid is filtered by the kidneys. In the kidneys, urine production takes place. So all the edema built up during the day turns into urine at night, increasing nighttime urine production. For patients with these conditions, it's crucial to manage these comorbidities. Another cause of nocturia is the use of diuretics. Often, meds like furosemide and hydrochlorothiazide are used for high blood pressure and heart issues. These drugs boost urine production and are often prescribed for evening use, disrupting sleep patterns. Other meds, like those for diabetes, can increase fluid intake. Patients who drink water after 6 or 7 p.m. will produce more urine at night. So, this could be one of the reasons. A small change in habits can make a big difference. Another cause is bladder-related diseases. We have overactive bladder, common in women but possible in men, and underactive bladder. Overactive bladder contracts excessively, associated with detrusor hyperactivity. The bladder muscle contracts too much. These bladders have reduced urine capacity. Any stored urine triggers bathroom urges. It's common in women. We'll discuss treatment later. Underactive bladder is the opposite. It doesn't contract. It accumulates urine, can't empty, leaving high residual volume. This residue causes frequent nighttime urination. In men, BPH, enlarged prostate, is common. BPH is closely linked to nocturia in men. Sometimes men come in reporting they get up 3-4 times at night, can't control their urine, and often lose it before reaching the bathroom. When we investigate, it's often a case of prostate enlargement. It can be managed with clinical treatment, medication, or surgery. For diagnosis, we talk to the patient, learn about their complaints, investigate clinical history, medications, underlying conditions, what they use and treat, and employ various investigation methods. Ultrasound, sometimes urodynamic studies, lab tests to check for undiagnosed conditions like diabetes. We may also ask the patient to keep a voiding diary. In it, they note urine volume day and night so we can assess if it's pathological. Given the diagnosis and identified causes, we'll direct the treatment accordingly. As mentioned earlier, we treat overactive bladder and detrusor hyperactivity with medication and physiotherapy. Pelvic floor therapy can greatly benefit both women and men, improving coordination and performance of the detrusor and pelvic floor muscles. Along with therapy, we can use medications like anticholinergics to reduce bladder muscle hyperactivity. Options include Retimin and Vesicare, among others. For underactive bladder, we often teach patients to perform intermittent self-catheterization. These are very specific cases. Sometimes we use long-term catheters temporarily until defining a permanent treatment. For benign prostatic hyperplasia or enlarged prostate, we use a range of medications to shrink the prostate and improve urinary flow and bladder emptying. We can also recommend surgical procedures to reduce prostate volume, such as scraping or transurethral resection of the prostate, TURP. These are endoscopic procedures, all performed through the urethra, and we can use laser or other technologies with the same purpose, but the goal is to partially reduce prostate size to improve symptoms. Many patients ask about prostate medications, while others are familiar with them. These include tamsulosin, doxazosin, finasteride, and dutasteride. These medications do have a range of potential side effects which we need to explain to the patient before starting treatment. But for patients who don't adapt well to medication, we have the option of surgical treatment. It's crucial when treating and diagnosing nocturia cases to guide patients on lifestyle changes like reducing water intake after 6 or 7 p.m. and modifying their eating habits. It's key to advise reducing chocolate, coffee, black tea, and mate tea, as these can worsen the condition. There's also a hormone called desmopressin, often used for children with nocturnal enuresis. For kids who wet the bed at night, desmopressin helps increase fluid retention. In extreme cases, when other methods fail, we might resort to using this hormone. If you found this topic interesting and relevant, or if it could help someone you know, please share this video and subscribe to our channel. Turn on notifications to stay updated with our weekly content. Take care and see you next time.